Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Carolyn Larkin Taylor. She's a neurologist, and today's Kevin MD article is How Medical Gaslighting Almost Cost Me My Life. Carolyn, welcome to the show.
Thank you.
Let's briefly share your story, and then we'll jump right into your Kevin MD article.
Okay. I'm a general neurologist, adult neurologist. I've practiced for more than 30 years. I'm now in semi-retirement, but I am still working. When I went into semi-retirement, I read through this journal that I had kept, which was my way of processing difficult situations in my life and in my career, sad cases that I came up across. It just really the kind that make you stay up at night and not sleep very well. So instead of staying up and thinking about them, I would just take them out of my head and I put them into a journal. And so I was reading through that and I thought that I saw how inspiring some of these stories were. And I decided that I was going to try to, now that I had a little more time, try to put them in literary form. And each story is separate and distinct, but they're designed to illustrate some universal theme, like addiction, medical gaslighting that we're going to be talking about today, grief, loss, death with dignity, things like that. So I had a lot of fun doing it, and I consider myself a physician, not really a writer, but this was a project for me that I really, really enjoyed, something I think I've always wanted to do.
All right. So tell us this particular article you wrote about medical gaslighting.
Yes, well, I wrote about this article. I illustrate my own case, and which I do throughout the book. It's a memoir essay. So difficult cases I've come up against across. That was one of them, but the death of other family members that I dealt with that had neurological implications. But this particular one, we talk and we read about gaslighting, and it's a common phenomenon, and I think we see it a lot among physicians that are dealing with particularly women and the elderly. And I have 2 points. One is it's not malicious at
Yeah.
all. It is something cultural, I think, that women tend to talk more about their problems. They're more verbal. Men are more likely to have that warrior mentality. So I think they're not always taken seriously,
hmm
especially when the doctor themselves can't figure out what's wrong. And
Yeah.
what I'm talking about. The patient keeps coming
Yeah.
back and
Yeah.
you've
Yeah.
done everything. You've looked at everything and you feel like you've done a good job and they're still complaining and you just it's just kind of hard to figure it out. And it was like that with my own case. I had been seeing a gynecologist for many years, maybe 20 years, this particular gynecologist. And I thought a lot of her. She was very well respected and we had a good relationship. And I went to her on 2 occasions over the span of a year with a symptom of postmenopausal bleeding.
Yeah.
And she did all the appropriate things, the uterine biopsy and the ultrasound assured me that everything was fine. And I was good with that. The symptoms would come and go. And so a year later, symptoms are back, and I show up and I say, the symptoms are back. I don't feel right about this. I think something's wrong. And she was getting ready to retire. She was closing her practice in 2 days and leaving for Europe, moving away. And she had a lot on her mind. And I think the last thing she needed was someone that she knew well, a physician as well, to come in and say, something's wrong and I need more help.
Yeah. Yeah.
So her response, and I think it was just out of frustration, was, well, I'm not going to do another biopsy. There's nothing wrong with you. This is just stress.
hmm
And I'm going to give you some names of other gynecologists in the area that I think would be good to work with, but you don't need to see them for a year.
Mm.
And so I thanked her for all her care and wasn't terribly reassured, but I thought, well, perhaps she's right, but I'm not any more stressed than I've ever been.
Okay.
And I'm not that kind of person.
Sure.
I'm usually very, very healthy. And so the more I thought about it over the next couple of days, I thought, I really feel like something's wrong
Okay.
and I'm going to take myself somewhere else. And not to one of the people she recommended. I went into an academic institution where I worked actually, because I live in Bellingham, which is 70 miles north of Seattle, but I worked
hmm
in Seattle. I lived there during the week. And, she was very alarmed. You should have had this
hmm
polyp removed a year ago, and we
hmm
really need to do a more invasive procedure and find out what's really wrong.
Sure.
And as it turns out, I had endometrial cancer.
Wow.
And as you know, the prognosis for that is if it spreads beyond the uterine wall to stage 2 is dismal. 25% of those people are still alive in 10 years, in 5 years. So fortunately, I was still stage 1, but it had been going on at least a year. And had I listened to this doctor, I probably wouldn't be talking to you here today because that was more than 5 years ago. So I'm very fortunate, but I listened to my intuition, and as a physician as well, I knew this wasn't just stress. But there are people out there that aren't medically sophisticated, or they get intimidated by their physician
Hmm.
that, oh, I guess it's just all in my head. They said I can ignore this. I'm going to ignore it. And I tell a story, and well, that was the story that I wrote, but that in my book, I combine it with another story of another patient that was pretty remarkable as well with a neurologic case. Mine was a gynecologic case.
Sure.
But my message really is to, physicians are not necessarily doing this out of malice. I
Yeah.
think there is a frustration the physician feels as well when they think they've done everything and they can't figure something out. But listen to your own intuition. And if you're not satisfied or you feel like something's wrong, advocate for yourself, ask the right questions, and go see someone else for another opinion if you're not
Sure.
happy.
So when you went to see that first gynecologist, your longtime gynecologist, and you had another episode of postmenopausal bleeding, what would be the response that you would have liked to receive from that gynecologist rather than what really happened, which is see another gynecologist in a year? What would you have liked to see happen?
Well, I realized her situation. She's closing her practice in a couple of days. I would have liked her to say, I'm sorry this is recurring again. Maybe we need to look into this again, but I don't have the time
Okay.
because I'm leaving. But I think you need to be seen right away. And I would have liked her to refer me to someone right away and say, you need to be seen because I can't handle this now at this
Hmm.
time in my career. Instead of saying it's all stress. It's all stress was not the correct answer, and I'm
Sure.
not going to do anything further. But it was wrong of her to say, you do not need to be seen for a year
Okay.
when she was not taking over my care and was leaving. And that's what I think. I think her saying it's all stress and putting me off for a year as if she was totally dismissing my complaints. And I'm not one, and she knew that complaint. She saw me once a year for a routine follow-up,
Yeah.
was the wrong thing to do.
Now, of course, we don't really know what she was thinking, of course, but if we were to speculate, the fact that a year ago she did do the pelvic ultrasound and she did do an endometrial biopsy, do you think that she was falsely reassured by doing those tests previously?
No, I think she was reasonably assured the first time. And then when I came back the second time, and she did another biopsy. As I understand it, and I'm not a gynecologist,
Sure.
but the appropriate response when there was a polyp that was seen on the ultrasound, she didn't do the ultrasound till the second biopsy 6 months later, was to do a hysteroscopy
Hmm.
and remove the polyp and better than just an in-office uterine biopsy. And had she done that, it would have been diagnosed then. And that's the procedure that occurred when I went to someone else. And she said right away, you need this right away. I'm going to get you on the books this week for a hysteroscopy.
And as you mentioned, if she was just transparent, honest, saying that my practice is closing in a couple days, you need to see someone now, that would have been a more reassuring encounter from your perspective, correct?
It would have, yes, yes,
In your article, you wrote that sometimes medical gaslighting doesn't need to be so explicit. It could be very subtle, right? It could be a smirk,
yes.
it could be a sigh. So tell us why sometimes these nonverbal cues can sometimes be more damaging than explicit dismissive words.
Well, I think our patients are very tuned into our body language.
Yeah.
Today we're in this difficult situation where we're forced almost to be typing while we're doing an interview with the patient because
Yeah.
there's just so little time and we have to document everything in the EMR. But Patients are sitting there, they're not typing, they're looking right at you, and
Yeah.
they are very tuned into, they sense what you're thinking about them. And if you just kind of smirk or you roll your eyes a little bit or you're in any way dismissive, I think that makes them feel small, and you're marginalizing and minimizing them in some way. And they think, well, maybe, I'm complaining too much and I should just, not speak about it. And I think some people are very questioning of their physicians. Other people are just, they'll follow
Yep.
everything you say. And you have to really treat every case like it's an individual case and understand, how they're feeling. And there's a lot of healing that goes on, not curing, but healing by talking to your patient, by listening,
Hmm.
by maybe, putting your hand on their shoulder to console them if, you're giving them bad news. There's a lot that goes on in the doctor-patient interaction that I feel we're losing today with the electronic medical record and the demands that are put on us.
Now, you're obviously a physician yourself. What kind of advice do you have for people who aren't physicians and have that, what you wrote, that nagging whisper in their heads, right? You alluded to this earlier, maybe get a second opinion. But like you said, some patients are 100% trusting of their physician. Now, tell us the type of advice you have for these patients who are trusting of their physician, but may have a little bit of that nagging whisper, thinking it may be something more.
My advice to them would be that, again, it's not physician malice. And it doesn't mean the physician isn't a good physician, but sometimes it's a busy day and they're frustrated with not being able themselves to solve your problem, that you can question them and say, I just be honest. Just say, I still have this nagging feeling that something's wrong, that we are missing
Sure.
here. And I would like you to, explore this with me or explain to me why it's not, or possibly refer me to someone else just so I can feel reassured. There's a way of saying that without, losing that relationship. And I think patients are afraid of that. I think they're a
Yeah.
little bit afraid of losing that relationship that they have with their physician. And if they question them, then that might happen. And I think a good physician is going to listen and not break off a relationship because the patient is questioning. But your own health is the most important thing.
Now, of course, this story comes from your book, like you said, your memoir.
Yes.
It's titled Whispers of the Mind, a neurologist's memoir. Now, for people who read your book, just tell us some of the key themes that you want them to come away with.
Well, it's a book that I want the readers to come away with the fact that it deals with courage, grief, and hope that connect us all. And we're all more alike than we are different. And it is an example, most of these articles are an example of the resilience of the human spirit. And so I deal with individual patient stories, which I
Hmm.
think teach us more than just talking about a condition. And the universal themes that I deal with are addiction, and especially the fact that addiction is a brain disease and not a personality flaw. Death with dignity, loss, grief. There's some of the main themes. And I tried to put a few funny things in there, but for the large part, these are sad stories, but they usually exemplify some, hero, which is the patient,
Hmm.
and how courageous they are. So I think it's a book that can appeal to most people. Can find something in there is that they can relate to, even if it's a concussion in your athletic child. How do you handle that? What do you do? And should you question the coach when they put them back in? So I deal with the whole variety of things that I saw as a neurologist.
And in this particular story that happened to you, this episode of medical gaslighting, how did that change you yourself as a physician when you saw patients?
Every case and the different cases that I write about in this book transformed me in some way. I learned from all my patients, every one of them. And this made me much more, I think, attuned to, I never want to make a patient feel that way.
Yeah.
And and in my practice, what I say to patients when I'm frustrated and I've done everything, and I will say, I'm open to the fact that I could be wrong. and let's maybe give this a little time. And if it doesn't get better or gets worse, we'll do more tests. Or I'm happy to refer you to someone who knows more than I do. I've always felt that way. I've always felt that I don't know everything. And I've always been happy to refer someone just to get another opinion, or I'll call them up myself and just talk over the case because in the end result is the patient is the important one here, not my ego. And I want to make sure that I've done everything that I can. And I want them to feel validated. I think it's very important for a patient to feel validated. And as a physician, we're often treated a little bit better when we go to see a physician because, they know what our training is. But I thought this was a particularly good example because not only am I a physician, but I'm another woman. And I just felt like that was an unusual way for a woman physician to treat another woman physician. But I knew her for 20 years and I think she was just rushed that day and in a hurry. And I was the last problem she wanted to be
Mhm.
faced with. And
We're
I
talking,
understand that as well as a physician.
we're talking to Carolyn Larkin Taylor. She's a neurologist, and today's Kevin MD article is How Medical Gaslighting Almost Cost Me My Life. Carolyn, let's end with some take home messages that you want to leave with the Kevin MD audience.
My take home message is that everybody needs to advocate for themselves and you need to listen to your intuition, or if you're not satisfied or you're still having symptoms and you don't have an adequate explanation, you're not going to sever your relationship necessarily with your doctor by questioning them. And I think your doctor, if he's open, he or she is going to appreciate the fact that you're open and honest and question their decisions.
The book is called Whispers of the Mind, a neurologist memoir. Carolyn, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you. My pleasure.